Hi everyone, my name is Carmen, and I am doing this presentation for my BCIT Breastfeeding Experience course. I will be examining the breastfeeding challenge of flat nipples and jaundice infants. I will look at this breastfeeding challenge using a situated clinical decision-making framework. This is the clinical decision-making process used. This framework helped me to gather all the information on the two aspects of this presentation and lay them out in a way that helped to address the gaps and find an appropriate way to assist a mother facing these challenges. The first step in this process was gathering all the knowledge I could around the topic. I first looked at flat and inverted nipples and the challenges that this can pose. Nipples come in many different shapes and sizes, and some of those different shapes and sizes make breastfeeding more challenging than others. Flat or inverted nipples are one of those challenges that breastfeeding mothers face. Approximately 1/3 of mothers will experience some of flat or inverted nipples. I then gathered information on newborn jaundice. Jaundice is an increase in bilirubin in the baby's blood. It is also known as hyperbilirubinemia. This increased level of bilirubin creates a yellowing of the skin and the whites of the eyes. Jaundice occurs when the body cannot effectively get rid of the excess bilirubin in the blood, which is normally excreted through urine and stool. Infants who are breastfed can develop breastfeeding-associated jaundice due to a lack of effective breastfeeding. This is because when there is insufficient breastfeeding and a resulting infrequent stool and urine output, and bilirubin is not excreted and reabsorbed, creating an increased level in the blood. After taking all this knowledge, I looked at the cues of flat nipples and jaundice. The cues take in signs and symptoms, lab data, and assessment data into consideration. Flat or inverted nipples are due to adhesions present at the base of the nipple that did not stretch or become more elastic in third trimester, which when changes in the breast usually take place. There are varying degrees of inversion when it comes to flat nipples. Some women may even have one flat nipple and one that does not have any degree of inversion. The adhesions present at the base of the nipple can lift once breastfeeding begins. If there are difficulties with flat nipples, the use of a breast pump can also help to bring down the adhesions. Some of the cues of a jaundice baby are a high-pitched cry, a baby that may be sluggish and cranky, and increased bilirubin levels in the blood, which would be found through lab data. And most outwardly present would be the yellowing of the skin and the eyes. In the judgment section of the framework, I looked at what could be happening for mother and baby and the effect on the feeding relationship. One main priority that comes to light in infants with jaundice is that they tend to be sleepy and irritable, making feeding even more challenging. It is important for the mother and baby to continue the feeding relationship during this time. Practicing skin-to-skin early and often can help with the breastfeeding relationship. Although it can be hard to wake a sleeping baby, it is important to breastfeed regularly, approximately every 2 to 3 hours, to help the infant have appropriate elimination. The next priority for a mother with flat nipples is that flat nipples can make breastfeeding more challenging due to the infant having difficulty latching effectively. An improper latch can lead to further problems like pain and tenderness. A lactation consultant would be able to find ways to improve latch. Many women may feel like if they have flat nipples that they will not be able to breastfeed their child. but there are many techniques that will help. The breastfeeding challenge of flat nipples can be difficult on its own, but when paired with an infant who has developed jaundice, this can negatively affect the feeding relationship. It can be stressful for both the mother and the child in this situation, and consultation with a healthcare professional would be helpful. A lactation consultant would be able to assist the mother and the child with techniques to improve feeding and provide support where needed. The 3 E's, early and often, effective feeding, and exclusive feeding, are the best way to overcome breastfeeding challenges. Lastly, I looked at treatment and nursing support available to mother and infant. Treatment for newborn jaundice is first to establish frequent effective feeding. An adequate intake of milk decreases the bilirubin level by stimulating bowel emptying. Here's a table to assist parents in monitoring output and elimination. Monitoring output is one of the ways a mother can tell if she is feeding her baby enough. Effective breastfeeding is usually a sufficient treatment in breastfeeding-associated jaundice, but in some cases, phototherapy may be needed. Phototherapy can consist of indirect sunlight or fiber optic phototherapy, which includes Billy blankets and Billy lights. I've included some pictures here. A mother facing a breastfeeding challenge will need a lot of support. In Campbell River, the community I live in, mothers facing breastfeeding challenges are visited by a lactation consultant, both in hospital and followed up at home. This program is called Healthy Beginnings. In other communities, it may be a public health nurse that assists with these challenges. They will help by assisting with feeds and helping with latch and positioning, as these things are important for a mother having issues. The last step in the process and in any of our nursing processes is to evaluate the outcomes. For the mother, we would evaluate if feeding has improved by assessing latch. Are the nipples becoming more properly formed through continuous effective feeding, or maybe through helping the nipples form properly with use of a breast pump or a nipple shield? The nipples should not be sore, and is the baby having an appropriate amount of stool and wet diapers? We can also assess if the infant's jaundice has improved by seeing if yellowing of the skin and eyes has gotten better, are bilirubin levels decreasing, and is baby less sleepy and irritable and feeding better. Overall, we can see how the breastfeeding challenge of flat nipples, which can lead to feeding difficulties, can also contribute to newborn jaundice. To follow up, I have included a few questions to ask to test your knowledge. Thank you for viewing my video on the breastfeeding challenge of flat nipples and jaundice.